Next we have Miss Tracey Brown, who will be presenting the importance of educating correctional staff in harm reduction and bloodborne virus prevention to play an active role in hepatitis C elimination.
Thanks. In the interest of time, I'll just move straight along. So a bit of background to this project. I'm sorry, I am going to have to turn this way slightly so I can't see down there. So basically, over 50% of people entering custody in New South Wales report a history of injecting drug use. There is poor access or no access to harm reduction resources. There is no needle syringe programs, and patients often report experiencing stigma discrimination from corrective services, from other inmates, and unfortunately from health staff as well. The custodial staff generally see the patients much more than the health staff do, and they get very limited, if any at all, education on harm reduction and hepatitis C. So the New South Wales Harm Reduction Reference Group, which is a joint group between Corrective Services and Justice Health, recommended that education needed to be reviewed and updated for all of these groups. So what we did was we then got it endorsed by the Commissioner of Corrective Services. We set up a high-level project governance committee, and then the project commenced. And the aim of the project was to design an online learning module in partnership with Corrective Services for the officers that promotes the reduction in drug-related harms through co-design and extensive consultation. We conducted all of the consultations on co-design with the officers, and the themes that came out were the officers really wanted words of colleagues, public health experts, and to hear perspectives of people in custody. They wanted practical steps that they could implement easily. They wanted rehabilitation to be seen as a job well done, and it was a self-achievement for them if they saw prisoners leave that were rehabilitated. And there was a lot of misinformation out there that they needed to be updated. After all the consultations, these learning objectives were agreed to. So identify social factors associated with drug use inside and outside of prisons, explaining harm reduction and how it can work alongside security-based approaches, understanding how stigma and discrimination can increase harms for people who use drugs and create risk for the community, describe current best practice strategies in prisons for working with people who use drugs, and understanding that harm reduction is an evidence-based professional practice and aligned with the National Drug Strategy and Corrective Service procedures. We developed the online module, and then we moved to user testing and validation with the officers. The officers reported that they really liked that it only took 30 minutes to complete. They obviously go through a lot of training. They liked the style, they liked the visuals, they liked the videos, they found it interesting and more engaging. They thought that the greatest impact was for new officers and new recruits, and they thought it was very unlikely that there would be any uptake unless it was made mandatory. It's proven to be very successful, and the outcomes are, we started it in June 2023, it went live. To date, we've had almost 260 officers complete it, and 84% of those have completed a post-evaluation. 100% agree that they achieved the learning outcomes and that they agreed their understanding of the topics had improved. 98% agreed that they could apply the knowledge and skills learned and it was relevant to their work. They agreed that design of the course allowed them to learn in their own way, and they stated they would recommend it to their colleagues, which for us was a big win. Other wins we got was the course has now been built into the redesigned primary training for the Certificate 3 and 4 in correctional practice, which was a big win, and it's now mandatory for all correctional service officers, community correction officers, services and program officers, and custodial case management officers. So the idea that it had to be made mandatory came through, and it is working. We'll continue to evaluate it and update it, and these are just a few of the comments from the officers that have completed it in the post-evaluation. I particularly like the first one. I learned to be proactive in the use of inclusive language that will minimise stigma for users of drugs. And to hear that from a corrective service officer is pretty amazing. Thank you.